Hey everyone, this is Hannah with the Rocket Miner giving you today's news update. Today I just want to give you some quick updates about some things that are going on with COVID-19 in Wyoming and just where things are at with that. So today Governor Mark Gordon announced that Wyoming's public health orders have been extended again. This time they're extended an additional 2 weeks going through September 30th. But there have been some slight changes, and one change in particular that was made to order number 1. So now the health orders will permit indoor close contact group activities and sports to occur in all settings. As far as extending the health orders with where they're at, as far as like outdoor group gatherings and indoor group gatherings, the governor said that he wants to see the impacts of the Labor Day holiday and the reopening of K-12 schools for in-person learning before he takes any additional steps to further ease the health orders. So because those things have happened and we haven't quite seen the full impacts of if we're going to see an increase in cases from those, that's why the governor said he wants to wait just a little bit longer before he makes more changes or relaxes the orders more. So that's why the orders with where they've been at will be extended again through September 30th for now, so we can see what effects those things have had. But there is this change with sports and what's allowed as far as that goes. So restrictions on outdoor gatherings were eased a little bit in August, and during that time outdoor contact sports were permitted to go forward. And they said that the health officials have been continuously evaluating how easing those restrictions has had an impact on case numbers. And they did say there were minimal issues identified as a result of the outdoor contact sports resuming. So health officials are going to continue to take specific and measured steps in easing the orders as the conditions warrant and as they continue to evaluate the effect that things have and where that puts us. Both Governor Gordon and Dr. Alexia Harris, our state health officer, noted that the procedures that have been implemented by school districts across the state have been largely successful in limiting the spread of the virus in schools. Protocols including social distancing and mask usage by staff and students have been effective in helping to prevent widespread outbreaks. To date, no school buildings in Wyoming have been required to close. So that's great that as we look at the effects that some of our recent actions have had, schools are doing really well. We're not seeing great spikes in cases from that. And the sports are doing okay, not seeing too much impact from allowing those to continue. So, as I said, the health orders that are in place will continue, but there is that change that now indoor close contact activities and sports will be able to occur. With schools, we're also looking at colleges throughout the state and the effects that their actions are having on COVID and the different steps that they're taking. Specifically, we've seen a lot from the University of Wyoming and the steps that they're trying to take to see the impacts that COVID-19 is having and to respond to those. So after they had had an outbreak, they had taken their pause. That pause lasted about 2 weeks, but as of today, they are going to go ahead and resume their phased fall return plan. So now they're going to be going into phase 2, which includes the start of face-to-face instruction. Different campus buildings are going to be reopening in a gradual manner, and they're still going to keep doing testing and health screenings for the employees and students. And everyone on the UW campus is required to wear face protection and to practice 6-foot distancing. They are seeing some new cases of COVID-19 still. Since Friday, there have been 27 new cases reported among UW students and employees. So the total number of cases among the UW community is up to 93. 16 students living on campus and 64 off campus, and then 13 employees who also live off campus. The president of the university noted, he said, "We know the virus is here, but we have been able to manage it in a manner that has kept our campus relatively safe." So they do still have some cases, but they are feeling confident enough to move forward in their phased reopening to start some in-person instruction, and they're just keeping an eye on where things are at and adjusting how they respond given the situation. The president also noted, he said that the traditional student age population is not usually negatively impacted by the virus as much as people of other ages or health concerns, but he noted that many members of the communities that support UW and the students on campus experience do include people who are at higher risk. And I think that's one of the good things to keep in mind when we think about our schools, especially elementary and high schools, and then even colleges as well, that usually if the students get the virus, they are the ones who are more likely to not be seriously affected by it. But their lives include so many other people of other age groups and people who are at higher risk for multiple reasons. So it's important to remember that it's not just about the students, it is definitely about keeping them safe, but it's also about keeping the other people in their lives safe as well. Looking at some of the COVID numbers and where we're at in the state, unfortunately we did see 4 additional coronavirus-related deaths recently added to our death total, which brings Wyoming's total up to 46 deaths. These were in Natrona and Sheridan counties. There was, 1 in Natrona and 3 in Sheridan. So in Natrona, it was an older adult woman who did have health conditions that put her more at risk, but she had not been hospitalized when she died. In Sheridan County, there was an older adult man who had higher risk health conditions, who had been hospitalized, who died recently, as well as another older adult man who also had conditions that put him at higher risk, and he had not been hospitalized when he died. There was also an older adult woman who was a Sheridan County resident who died in August after she was exposed to the virus in an out-of-state long-term care facility where she was receiving care. So as I said, those 4 additional deaths put us up to a total of 46 for the state, which is unfortunate always to see that number go up at all. But thankfully we have seen more progress and some good positive things with the rest of our COVID-19 numbers. So today we're up to 3,762 confirmed cases with 676 probable cases. We had 39 new confirmed cases since yesterday, and yesterday there were 44 new confirmed cases. This is a little higher than where our average has been at. According to the governor's statement about the health orders, they said that over the past 14 days, Wyoming has averaged approximately 31 new cases per day. So that's a little bit higher than we've seen in the last 2 days. They also noted that the percent of COVID-19 tests with a positive result is 2.1, which is a pretty good percentage actually to be at. So we're thankful that that is one of the areas that's improving. But even with the slightly higher numbers of new confirmed cases last 2 days, thankfully we've also seen good numbers of recoveries. Yesterday particularly, there were 116 new recoveries in the state, and today there were 42. So that puts us at 467 active cases today. This is up just a little bit from yesterday. It was at 463, but that drop down to 463 yesterday was a drop of 73, which was almost 14%. So that was a big drop yesterday. We've seen it go up just a little bit today, but not too much, thankfully. So actually, this is pretty good and pretty positive that we're seeing the numbers start to go down more. Obviously, we're pretty significantly below 500. We're at 467 today for active cases, and the number hasn't been that low for, I think, a couple weeks now. So it's starting to go back down. Definitely encouraged by seeing that the recoveries are kind of starting to outpace the new cases. So we definitely just want to see this continue to see the numbers improve, the number of active cases drop, and the number of recoveries going up. And I think it's important just for the whole state to just keep seeing where things are at and keep seeing how our actions are affecting things. I think this is something that our officials have been doing really well, is when they make changes, they look at what impacts did those changes have? Did the cases go up? Are the cases staying okay even with those changes? How can we adjust what we're doing so that we can continue to be careful but also continue to go forward? The governor said, "Wyoming has really held its own. Schools are open and sports are being played on Fridays and Saturdays. We want to be careful to avoid going backward and losing the high ground we hold. Steady progress beats the alternative, which would be devastating to our businesses, our schools, and our citizens." And I think this is really important, just to keep in mind that we don't want to just throw caution to the wind and just go forward and do things without taking any precautions and see our cases spike again. That would have such a negative impact on so many different levels. But I think it's awesome that we're able to keep reevaluating, readjusting where things are at, and just move forward carefully and think about the effects that our actions have and see what is okay to do, what's not okay to do, and just keep adjusting. I think that's what's important, and that's what it takes to keep moving forward. And I'm glad that we are starting to see some of that progress. So that's my update for today and where we're at with COVID-19. So thank you for listening. Keep checking back with us for more updates on the virus and other news. And I hope everyone has a good night.